Hello friends, I hope you're doing well. In today's video, I would like us to discuss antibiotic resistance. Now this is one of the problems I've been able to discover with concern at the Sickle Cell Clinic, and I've always wanted to talk about it. So what is antibiotic resistance? This is a situation whereby you find the bacteria has developed resistance against the antibiotics which you're taking for the condition you're suffering from. It is a very dangerous problem, and it has left most sickle cell warriors suffering with very many bacterial infections. There are two main causes of antibiotic resistance. The first one is overuse of antibiotics, and the second one is misuse of antibiotics. Majorly in sickle cell warriors, it might be due to overuse because of the low immunity. They are already suffering from bacterial infections. But then the other side of it all is that it is due to misuse of antibiotics. How do we misuse antibiotics? In most families, you find that a dose which has been prescribed for one person is being shared by almost the whole family, and in such a situation, it means the doses are being divided and they will not be able to attack the bacteria and kill it. And in such a situation, the bacteria is given enough time to build up a resistance, and that's how antibiotic resistance can come about. And in other situations, you find that someone has been given antibiotics, and after taking the antibiotics and the symptoms have disappeared, this person stops taking those antibiotics and then starts them again when the other symptoms reappear. In such a situation, you find that the bacteria is able to build up resistance against the medication which you are taking. Another main cause of antibiotic resistance is buying medications over the counter. This is whereby you find that after you've seen certain symptoms on your body, without even knowing which disease this might be, you guess, and then you go to the pharmacy, you just buy the medication without going to the hospital, without even going to the laboratory to do a certain test to confirm that very infection. So the advice I'm giving out to us is that please stop buying medication over the counter. Always go to the hospital and tell your story to the healthcare providers. Then they'll be able to determine which medication is good for you. In some health facilities, culture and sensitivity is first done to confirm exactly which bacteria is causing that infection, and then the target antibiotics are used to kill that very bacteria. In this situation, you find that really the medication is very effective in treating your conditions. So please always go to the hospital, always go to the doctor and tell him what you're suffering from, and then they'll be able to determine which medication is good for you. Stop self-medication in order to fight antibiotic resistance. Then another thing is that if you're given a medication, even if you have taken it and the symptoms have disappeared, don't stop the medication. Take the medication until it's done, and by this way you'll be able to fight against antibiotic resistance. Then another thing is that let's stop sharing doses, because you see the doctors, to give you certain medications, they ask for your weight. So the medication is given a certain milligrams per kg. So in a situation whereby you find you're dividing the doses, it means you're making the antibiotics weaker, and in this situation the antibiotics will not effectively attack the bacteria which is causing that very infection. And in this situation, you find that most antibiotics are not able to heal your condition. So please, I hope you have been able to learn something from this video. Let's work together to fight against antibiotic resistance, especially in our dear sickle cell warriors. Thank you so much for watching this video. Please consider subscribing, liking, and also sharing this video. See you in the next video. Bye.